Hello, everyone. You're very welcome to our FY Focus Career Planning webinar. Full disclosure, this is a re-recording of the live webinar we did on the 30th of January. And we were hoping to post the live one with the Q&A, but unfortunately, due to an audio issue, we've been left to resort to doing our full recording with just myself and Neil on our slides and PowerPoint presentation that we delivered during the live webinar. So this ultimately is a bit of a whistle-stop tour and a brief guide to go through the application process to UK Foundation Training and a little bit about what UK Foundation Training is comprised of and an explanation of its aims and its role. So in terms of us at FY Focus, if you're unfamiliar with some of the work that we do, we're basically a small medical education company and informative platform that help medical students and junior doctors who are new to come into work in the UK and to Ireland as well. And we also provide some courses and resources to help people prepare and to succeed in that journey and ultimately smoothen the transition from medical student to junior doctor life. So in terms of our background and a little bit more about us individually, my name is Brian McGowan. I'm an internal medicine trainee in my second year of training here in Belfast in Northern Ireland. And I completed my own foundation training over in Scotland, in Edinburgh. And then I worked for a year in A&E over there after I completed my foundation training before coming back and doing internal medicine here in Belfast. And then, of course, the other half of FY Focus is Neil, who I will let make his own introductions.
Thanks, Brian. Hi, everyone. My name is Neil Murphy, and I'm from Donegal and went to school with Brian and also went over to Białystok in Poland to do our undergraduate degree. On completing that, I wanted to come home closer to home, so I picked Northern Ireland as my F1 and F2 choice, with F1 in Derry being nice and close to home for myself, and then my F2 year being in Belfast. I've since stayed in Belfast. I've loved it here and did a year in A&E before going into the GP programme, and I'm now in my second year of that. So hopefully with me picking the GP more community side of things and Brian pursuing his career in consultancy medicine, we'll hopefully give you a nice broad idea of all the career choices that is going to come your way in the next few months and years. So just the next slide will just be a little bit on what we'll be talking about today, just a re-agenda. Really, it's going to be 45 minutes roughly of myself and Brian talking uninterrupted, really just kind of doing a whistle-stop tour on the kind of things to be aware of when applying to foundation. We'll talk about what is involved in the foundation programme, the UK FPO, which is what really is your bread and butter in terms of getting your questions and answers for the application process. They are amazing, you know, when you're coming from a different school and maybe unique circumstance, like myself and Brian were coming from a school that hadn't had anybody go that route before. So they were very accommodating with, you know, personal emails and stuff to really help you. So they are probably the best people to talk to about the application process. Myself and Brian are always very happy to take questions over DMs and emails as well. But in terms of applications for you specifically, they are the best people to go for your answers for all your tricky questions in terms of your application process coming from a different country. We'll talk about application strategy, job preferencing and location, recent changes, and IMG stands for International Medical Graduates. That's what myself and Brian were, and that's what you guys are when you're studying from outside of the UK. So basically what we're going to touch on is everything the UK FPO can't help you with because, like I said, they'll help you with your application process, but then the job picking and career preferencing is all up to you specifically, and it can be extremely overwhelming. And after being through it before and after working through it, having friends that have worked through the foundation programme as well alongside us, I think we can give you some good personalised help and tips to try help you preference your jobs and shaping the career that suits you. So That's yourself.
I can take this one. So, in terms of what is the UK Foundation Training Programme, essentially, foundation training is a 2-year internship program where you work in the UK as a junior doctor and are paid to work as a junior doctor. And it's basically an internship program that everybody must complete before going on into higher specialty training in the UK. And it's the same for graduates of UK medical school. Also, the same obligation still applies. So it consists of 2 years with 6 4-month rotations. And in your first year, for example, you'll have 1 4-month rotation, definitely in medicine and medical specialty, and then 1 4-month rotation in a surgical specialty, with the outstanding 4-month rotation being in something like GP in the F2 year, in A&E, could be any other community placement, could be a rotation through a cancer center, or in something like psychiatry. So those will be sort of how your jobs are varied over the 2 years. And then it'll be different based on your preference and what you have been assigned after you have applied. Now, there are a few other types of foundation training programs which ultimately are very similar, but they will have a slightly different outlay. So those ones will be the Specialized Foundation Program, which is here on this slide. So that used to be known as the Academic Foundation Program back when Neil and I applied in 2019, or AFP. And that's quite similar, but the only difference is one of the 4-month rotations will be something where you have the opportunity to engage in research or a leadership and management skills program. Neil and I can't really speak too much about our experience with this, as ultimately we didn't apply and do this type of foundation program, but we have had a couple of friends who did and spoke highly of it. The vast majority of people will apply and do just the standard UK foundation program, which is 2 years and has the 6 4-monthly rotations. The other one that we'll not spend too much time talking about is the Foundation Priority Program. And this is really for people who want to work and live in remote areas of the UK, for example, in the Shetland Isles or in Peninsula and places like that. And these people get their own sort of application process because although these places are remote, they still have hospitals and healthcare centres that need doctors, that need to be staffed with doctors, and they want to prioritize these applicants to ensure that these hospitals can be staffed ultimately. And then the last one you'll see down the bottom is the Psychiatry Foundation Fellowship. Neil and I don't have an awful lot of experience with this program. I believe it's quite new, but it's ultimately a foundation program for people who are thinking of doing psychiatry down the line, with more focused rotations in that area of specialty.
So no matter what foundation program you pick, like what all the different options Brian was discussing, your next selection after picking your foundation program will be what location you want to be in. Now, if you're applying to the UK is split into 21 different regions. They are called deaneries on the UK FPO website, which can be a bit confusing sometimes, but it's basically what region that you'll rotate within your F1 and F2 year. So everything that what we will talk about in terms of different job selections and different career paths and stuff, they all exist in all these regions. So there's nothing in there's no job in Northern Ireland that isn't in, North London. So it's for picking jobs, it's definitely where do you want to live for the next 2 years. It's a huge choice. It's a huge decision. And from our experience, it shouldn't be job orientated where you pick the next 2 years of your life. First, you need to sit down and think, where do you want to live the next 2 years of your life? It could be personal reasons, family reasons, whatever it is. I think it's the most important choice to think about for the next 2 years. It doesn't mean that you'll be there forever after. Like Brian said, he went to Scotland for the first 2 years and then came over to Northern Ireland, but it's where you will be for the next 2 years. So it is an important one. What we drew up here is just the competition ratios over the last 3 years. You can see so what the numbers are. It's how many applicants for one job. So as you can see, obviously London is the most competitive one, having 2.41 applicants in 2023 for every one job. And then like places like Brian was saying, and the more regional areas like East Anglia and Peninsula and things like that, that they struggle to actually get one applicant for each job, with East Anglia 0.4. So quite low numbers. Northern Ireland has been on the rise, and you see last year it's 0.94, so nearly an applicant for every job post there was available. So as you can see, the competition ratios are increasing every year. Hard to wonder why, or it's a bit paradoxical why, when NHS is in the news all the time for bad hours and bad pay, and nurses and doctors on strikes and things like that, and services maybe not being the best. But I think it's proof that, you know, everybody wants to, or a lot of people want to train in the UK, and there's no doubt, hours aside and money aside, that it is a fantastic place to commence your career. So I think the proof is there when you see the numbers of people that want to come. So,
and just to add to that, I think it's testament to the fact of the quality of the training in the UK, despite the negative press, like Neil talked about. The UK does rely a lot on foreign trained doctors, and more doctors who have trained abroad want to come and work in the UK. And as we'll go through in some of the slides, you know, the NHS and the application process very much caters to people who have studied abroad. And as we'll highlight, you're not at any disadvantage at any point in the application process if you have trained or worked abroad before coming to the UK to continue your training. So sort of give some circumstance and explanation as to why these competition ratios are rising and continue to rise year after year. So anyone who is in the stage of applying to commence work in foundation training later this year in 2024 will be very familiar with this application timeline. And as you can see, the application really opens almost a year in advance of when you're due to commence work, really around the September time, with some of the guidelines with different dates coming out in July. And this really, when you take a step back, can actually catch you off guard if you're not really familiar with these dates and know in advance of when the application window opens. And back in 2019, when Neil and I applied, this very nearly caught us out at the time, as there definitely is a zero tolerance policy with the application windows and their deadlines. So you really need to be hot on your dates and be starting to get your paperwork together and having a look at the timeline well in advance before any of the deadlines come up. You will see as well that all medical students of UK medical schools are actually auto-enrolled in the FY recruitment process. And that's just simply because the vast majority of students who study in UK medical schools will ultimately end up completing the foundation programme in the UK, with a very small minority going abroad to do foundation training or an internship programme elsewhere. But I do want to highlight, just as said recently before, that is the only form of preferential treatment that students who study abroad get in the UK application process. Everything else is completely standardized in terms of the requirements and the access to the timelines, and when you get your timelines for your preferences and the updates and upgrades when you come to offering your job. So I think there is some reassurance in that fact to know that you're all in the same boat, especially when it can get stressful in the application process, that it is completely standardized and ultimately very fair. So if we go on to the next slide, we'll see where we are now in the application process, and we have sort of where we're highlighted there just in the red circle. For people who are applying at the moment, you're really going to be at the position of ranking your deaneries, or where Neil had in the previous slide, the 21 regions where you're really going to be choosing to work. And that is ultimately just deciding the location of where you want to be and your first preference. This point really isn't too bad in the application process, as most people have a fair idea of where they would like to be, and where they would like to live for the next 2 years. And the stress really doesn't come until after, when you get allocated your deanery, which as you'll see down the bottom is around early March. And that's when you're going to get a list of very long, all the jobs and all the rotations every 4 months, and which hospitals they will be in. And that's really when the stressful period starts. And we use the Oriel software to allocate these jobs. So I don't know about you, Neil, but the time when we applied, just seeing the Oriel interface brings back the nightmares and the horrors of how stressful the time was. And you start to wonder why that might be. And ultimately, if I give my own anecdote at this time, Neil and I were in uni in Poland, and it would have been sort of early 2019, when I was looking at a list of about 100 jobs in front of me, in hospitals that I'd never stepped foot in. And I really wasn't sure what career path I was considering, what area of medicine or what specialty I wanted to do. And at the time, I had actually never been to Scotland before, or been to Edinburgh, and never been to any of these hospitals. I had no orientation of the city or where I was going to live. I didn't have many friends or contacts there. And the whole application process seemed crazy, that I was deciding this for the next 2 years, and I was completely locked in and tied in. And it seemed very overwhelming, to be honest. But the important thing to take reassurance is that many people are in the same boat when they're applying to work in foundation in places that they haven't been before, and they don't know a lot of people, and they don't have their accommodation organized. And the only way to really rationalize it and sort of find peace in the whole process is to employ some form of a strategy when you're doing that. And we very much have sort of a simplified strategy of the things that you can control in the application process. And we'll see on our next slide that we think really you need to prioritize your location and your living circumstances, and what your commute to the hospitals every day is going to be like. And then once you have sort of a better grasp of that, then you can start to consider what specialty of interest you want to pursue in your work. So when you think about that, that might seem very counterintuitive in the first instance. And that's because there really is a lot of pressure on us as medical students and junior doctors to absolutely prioritize our career, in the very first instance. And whatever happens in life should come second to that. And I think that's really probably not the most sensible and rational way to look at things. And if I give my own example of a commute that I used to do when I was in my FY1 year over in Scotland, I had a 45-minute drive to a district general hospital. And I was actually in this hospital for 8 months. And in the first instance, that mightn't seem too bad or seem too difficult. But, this was a commute that I used to do after a 12-and-a-half-hour long shift at the weekend. After a 12-and-a-half-hour night shift, I would have to get in the car and drive back home and not on any sleep. And, ultimately it was manageable, and I got it done in the end. But absolutely, if I was to wind back a year in advance, it was something I wish I had considered when I was preferencing, what hospital I was going to work in, and something that I wish I had researched more and given more consideration for, because ultimately you will spend a lot of time at work, but it's all the time around work as well that really impacts sort of your lifestyle and where you want to be on your time off. I definitely wanted to be in the city of Edinburgh at my weekends and my time off, but to have to do the 45-minute commute for 8 months and then add traffic on as well was definitely an impact, and something I wish I had considered earlier. I think if we go back then to the other slide, Neil, the other thing that we sort of want to talk about is what it's actually like working as a junior doctor and as an FY1, and why that doesn't actually matter as much based on the workload that you have. Do you want to talk about that?
Yeah, so I know we'll be reiterating everything that we're saying, but this is just to hammer home the the reasoning why we think location is everything for F1. And the reason behind that is because as an F1 doctor, it doesn't matter what ward you're on, your job is exactly the same. Listen, we've been in those lecture halls, we've had those medical student colleagues who tells you that they want to be a neurosurgeon since F1, or sorry, since their first year in college. And yes, it's great to be looking at cardiothoracic jobs and neurosurgery jobs and things like that. But in F1, it doesn't matter what ward you're on, your jobs will be the mundane, boring jobs of doing bloods, doing cannulas, doing discharge letters, scribing for the consultants on their ward rounds, prescribing fluids and different things like this. All very important tasks and very important things that you need to be very good at. And it's appropriate that you have a full year of doing these mundane things, that you can do them very quick and efficient at the end. But it doesn't matter if you're on a cardiology ward versus a geriatrics ward versus a cardiothoracics ward. Your jobs are going to be exactly the same in F1. So if it's cardiothoracics you want to do, if it's cardiology you want to do, neurosurgery, there's no point doing, not that there's no point doing them in F1, but it's not where you're going to get the experience of that specialty. It's important to note in F1, there's no access to clinics. So you're not going to be in the outpatient clinics. There's no access to theatre. So if you're in a surgical job, you will not be in theatre. You'll be on the ward when the seniors are away and you're doing all the mundane tasks. That's why we like to hammer home the point, after being through it ourselves and Brian given the example of his long commute in F1. Location is everything for F1. And in terms of picking your specialties of interest, we would save them for F2. In F2, you're no longer classified as an intern. You used to be classically called an SHO, so senior house officer. So you're definitely more of a senior member of the team. So if you are an F2 in a surgical job, there will be more options for you to go to theatre. You will be admitting the new admissions and seeing very sick patients. So if it is a job that you fancy, or if there is a job that you fancy that you'd like some exposure to, and maybe that will be your career, F2 is the time to do it. But in saying that, we like to say if you don't get it, so like the specialties do matter in F2, not so much in F1. But if you don't get it in F2, it's not the end of the world. Both myself and Brian are actually pursuing careers in something that we didn't do in F1 and F2. So it's kind of funny that way. F1 and F2 is fantastic, I think, in terms of its six jobs that you're going to do in the 2 years. And they're all very different. So you're going to get a lovely broad view of all different specialties. And then hopefully at the end of F2, you kind of know what you want to do then, or what lots of people say, you find out what you don't want to do after working a few jobs that you definitely didn't like. It's worth mentioning as well, if there is something that you think that you would like some experience into in F2, there is an option to do these taster weeks. So I think it's about 2 weeks you're allowed. You can do 2 weeks all in one, or you can do 2 separate weeks. It'll depend on where you are and what on-call rota you're on and things like that. But it gives you the option to go into a specialty and actually properly see the specialty, rather than being on the ward and have to do the mundane tasks of the F1s and the F2s in that job. So it would be, for example, if you felt that you wanted to be a neurosurgeon, you do a taster week in neurosurgery and you'll be with the neurosurgical consultant going into theatre and actually seeing the stuff that you're interested in. Whereas if you're actually working that job for 4 months in F2, you might be doing the admissions part and, be doing consent for theatre and things like that, whereas you mightn't actually be seeing, an actual interoperative case and being fully explained to you like a medical student. So I know Brian did that for cardiology in his F2 year, and it really stood to him, and now he wants to pursue a career in cardiology. So it definitely doesn't matter if you don't get your dream jobs in F2. All hope is definitely not lost. A few words about changes, Brian. Do you know about these more than me?
Yeah, absolutely. So I think there was just one other point that we wanted to add on to there in the last slide, Neil, if you go back. Just in terms of which order to do some of your rotations in, if possible, for that to be facilitated. there is probably definitely some truth behind getting to do a medical job as your first job in FY1, as it's a little bit of a nicer introduction into the workplace and being a junior doctor on the ward. And the rationale behind that is really there is definitely the opportunity for some more supported learning in doing your medical job first as opposed to a surgical one. There just tends to be more seniors around and more involved in sort of the medical issues of patient care on medical wards, which is understandable. As on a surgical ward, there may be a degree of sort of more expected autonomy in the management of the medical issues. You know, surgeons come in to diagnose a patient and to do an operation on the patient and manage any potential complications. And the medical issues can sometimes not be their utmost priority in these environments. So some of that responsibility may fall onto you, or to be able to seek help from the medical team. And it really does help a lot if you have a little bit of familiarization with management of medical issues, having worked on a medical job first before rotating through to surgery. Now, ultimately, that's not going to be possible for everyone, of course, as on day one of the first rotations, surgical wards need F1s and F2s. And, you know, it's just not going to be possible. It's not going to be the case that everyone can start on a medical job. But it's definitely something to consider when you're ranking your preferences, if that's something, you know, that would be important to you. As it actually worked out for both Neil and I, we ended up doing surgical jobs first, which was definitely a little bit of a baptism of fire, and definitely being thrown in at the deep end. We managed to get through it in the end, but it was something that we weren't familiar with, that, you know, there could have been it could have been good advice to preference starting on a medical job as opposed to a surgical one. If that can be facilitated, it is helpful.
Yeah.
So in terms,
fully scare you. Sorry, we don't want to fully scare you. Like, if you do get surgery as your first F1 job, yes, it's going to be a lot harder. It's going to be a lot more kind of hitting the road running. But it definitely stands to you. I feel myself and Brian definitely felt a lot more confident after our first 4 months, going into a medical job and then actually having a registrar and a consultant more available. It's just like Brian said, a more of a bit of a handheld introduction into your F1, whereas in surgery, you're very much after. I know I was on an orthopedic ward, and you know, it was 30 patients seen in 30 minutes in the ward round, and then your seniors are gone, and it's you and another F1 for the whole day. And most 90-year-old people who have a broken hip, they have other issues as well, you know, so they might, you know, I remember reviewing patients and they were like, day 2 hip operation, you know, plan is to get them up and moving, but the surgeons ignored that they're on 10 liters of oxygen and their heart rate's 180 and their blood pressure is low. So, and then that's left to you to manage. So, which definitely won't happen on a medical ward. So, it's a baptism of fire, definitely, for your F1 job, but it toughens you up. But either way, I think there's pros and cons to starting in both. But if you do have your preference, then medicine would be a nicer introduction.
So in terms of some of the recent changes to the UK foundation recruitment process, it is actually in its first year of some rather drastic changes. Now, all of these are well explained, and the rationale behind that on the UK FPO website. There is a wealth of information to explain all these changes. The biggest one, especially for this year in the recruitment process for people starting work in 2024, is that the SJT, or the situational judgment test, has been removed, and it's been replaced by this PIA, or the performance informed allocation. Now, the reason behind that is that the SJT is an additional exam that you have to do, which counts for 50% of your application score, or did count for 50% of your application score, with the other 15% being made up of your performance in exams in university. It did create additional stress and a lot of administration burden on both sides in preparing for the exam. So that has been removed and replaced by performance or preference informed allocation. Ultimately, we don't know an awful lot about this at the moment, but it is basically a software system that allegedly has been shown in trial runs to assign more people their first choice preference in area and job and location that they will be assigned to. So I think it's only going to be around for 1 year with different talk about an additional exam coming in later, the UKMLA, which may replace this in the future. So because when Neil and I applied, and right up until last year, it was the 50-50 split between the SJT and your university grades. But we'll see how this goes and how long it hangs around afterwards with the new system and the preference informed allocation.
Just a few potential snags for us IMG graduates. And IELTS exam, I'm sure you've heard of it. It's the International English Language Test. Lot of different controversial stuff out there between different people if you need it or not. We certainly would, when we were messaging the UK FPO, because we were the first students kind of from Bialystok going this route, they couldn't give us a solid answer if we needed to do the test or not. Basically, it's an exam, costs £250, just to prove that you can speak English proficiently. The two of us, English is our first language. It's the only language I'm able to speak, and I still just about passed it. It is tough. It's a long 6-hour exam, but we know people that came from our university and other universities that were able to get a letter from the dean that said that they had enough English. We wouldn't advise either or. We played it safe and we did the exam because we didn't want to end up with, at the end of the day, the application process can be ruthless. And if they turned around and told us that that's not good enough, then we didn't want to waste it. So we thought it was worth doing it. So it's up to yourself what you want to do. Maybe there's people in your colleges that have been through this process before, maybe getting more advice from them. But we would advise to be safer rather than sorry. The prescribing safety assessment is a prescribing exam that you'll have to do in F1. The UK students will have it done with their final exams. It's basically an examination of kind of safe prescribing on the wards. It's nothing that you don't know from before. You would have well covered it in pharmacology if you passed pharmacology, and it's actually kind of showing you how to prescribe safely by using the British National Formulary as well, which what we use. It comes in book form and app form. Not something to worry about now. It's something that you'll do in your F1 year, and you can prescribe without it, but it needs to be completed in your F1 year, and your foundation school will have it organised for you. So you don't need to worry about it right now.
So that's really that's really all we have to say about our experience of the FY application process and some of our advice of how to strategize your approach when you're going through the application process. As we know, it can be stressful and overwhelming. There's absolutely other approaches that people recommend and employ, and there is no right or wrong way. But I think when you're faced with a stressful situation and you're not really sure what to do and you're a little bit overwhelmed, you need to employ a strategy, I think, is definitely the most correct advice that we can give you, and to be diplomatic about it. We're also very excited to announce some of the courses and resources that we do at FY Focus. I'm sure many people are aware that we do run an FY, an intern crash course. And we have ran many successful courses here in Belfast, in Northern Ireland. But to reach out and help sort of more people that are studying abroad and are going to be coming back to Ireland and the UK as international medical graduates, we're excited to announce some international courses, crash courses that we're looking to run this year. And we have booked a conference centre at the Amber Hotel in Gdansk on Saturday, the 9th of March, 2024. And then we're also going to be in Bydgoszcz in the Holiday Inn on Saturday, the 13th of April this year. So we will have all of our medical simulation equipment with us for the day. So we really cover all of the core competencies and skills that you really must be competent in for your first day as being a junior doctor, and sort of our rationale towards starting FY Focus and designing these courses. It's stuff that we really want people to have a head start in, especially if you have studied abroad and are new to working in Ireland and the UK. We always say, we're very happy with our theoretical knowledge, having studied abroad, and we felt confident in that regard. But certainly, having been through it ourselves and coming to work in the NHS in the UK, there is certainly an emphasis here for medical students to be more competent in clinical skills and be really sharp in having those fine-tuned and honed in for your first day at work on the ward. And we felt that was lacking a little bit for us. And it made things a little bit more challenging for when we started work, when we weren't as competent in doing bloods and cannulas, or when we were called to an acutely unwell patient, and being familiar with the news score and know to how to manage that and examine them in an A to E fashion, and then communicate your findings and ask for help along the way. So those are really the core skills that we want to focus on and allow people to become more confident and competent in for when they start working. We do cover a lot of the other core procedures at these courses, so urinary catheterization, NG tube insertion. We do touch on sort of ECG interpretation, chest X-ray interpretation, interpreting blood tests when you've seen an acutely unwell patient. And then we tie it all together with some of the prescribing modules